The unrelenting rise in coronavirus cases here in the U.S. shows no sign of slowing down at all. An additional 66,000 new cases were reported nationwide yesterday, bringing the total number of new cases in the past week to more than 443,000. Meanwhile, some of America's biggest retailers have announced mask mandates for shoppers. We're talking about Walmart, Kroger, and Kohl's, even if there is no local mandate in place. But the move is not coming without major pushback. CBS's Laura Podesta has more on the fight to slow the spread.
Montana and Alabama are the two latest states to issue mask mandates.
My first duty is certainly to ensure the health and well-being of all Montanans.
Alabama reported its highest number of daily deaths for a second day in a row yesterday with 47.
You shouldn't have to be ordered to do what is in your own best interest.
About half of all governors have issued some type of mask requirement as cases rise in more than 40 states. But in Georgia, Governor Brian Kemp signed an executive order that prevents local mandates.
It's disappointing, and it's just very hard to understand how that actually benefits public health.
Ohio Governor Mike DeWine isn't ordering residents to wear masks either, but he did issue a stark warning to people not using them.
We're literally playing a Russian roulette game with our own lives and our families and our neighbors.
Oklahoma Governor Kevin Stitt has also resisted a mandate. Yesterday, he became the nation's first governor to test positive for COVID-19.
I didn't have the traditional symptoms of COVID, and that's kind of interesting for us to think about.
Health officials say young people have been responsible for the uptick in some areas of the country. Doctors with Florida's Jackson Health System warn the state is close to running out of bed capacity.
And we won't be able to take patients in. They'll just be stacking in the ERs.
Florida's case total passed 300,000 yesterday, with more than 100,000 coming in the past 2 weeks. Laura Podesta, CBS News.
So cities and counties in Georgia have now been banned from instituting their own mask mandates. That's right. The order was signed by Governor Brian Kemp, and it voids all existing mask mandates while also extending other coronavirus social distancing restrictions statewide. So we're going to talk about this. I want to bring in emergency medicine physician, Dr. Uché Blackstock. You are in New York, doctor. You are Yahoo News' medical contributor and founder of Advancing Health Equity. So I want to talk to you about kind of the clashing of messages. When the governor signed this order, there were mayors, the mayor of Atlanta, the mayor of Savannah, that were outraged. The mayor of Savannah said, well, looks like he doesn't care about us. It's every man and woman for himself. Can you talk about your concerns as a doctor when you have a governor, for example, or other voices of authority disregarding the need for masks? And maybe he's not outright disregarding it, but he's not mandating it. So he's not making it a top priority to the point where he is forcing other municipalities to break their mask mandates. What does this mix messaging do?
So it is incredibly disturbing and concerning. One of my physician colleagues who's actually practicing in an ER in Georgia said, it feels like he's actively trying to kill people. We know the scientific evidence. We've seen it here in New York City that masks work. It doesn't really make much sense at all that even with the surging cases in Georgia, the increased deaths and hospitalizations, that he would issue this mandate telling localities that they cannot mandate wearing masks. And so, what I think will happen there is we're going to continue to see a surge in cases unless more restrictions are put in place.
So, Doctor, one of the things that I find remarkable is the country's top doctors, ranging from Dr. Anthony Fauci to Dr. Robert Redfield, have said that the number of people that can be saved by wearing a mask is the difference between, let's say, losing 200,000 plus lives by November and maybe only, and saving perhaps 66,000 or 75,000 lives just by people across this country wearing masks. So will the state of Georgia, for example, that is now outlawed, I guess, these mask mandates that individual localities have implemented or had implemented, will that state, for example, be able to flatten the curve?
Oh, absolutely not, given the current situation. There's no way that we can flatten the curve if people are not mandated to wear masks. I personally think that there should be a nationwide universal mask mandate. We know that something as simple as even wearing a cloth mask that's not as effective as N95 or surgical masks are still incredibly helpful. We also know that there are a lot of people walking around without symptoms or pre-symptomatic who have coronavirus, and those are the people who are often spreading the virus to others. And so if they're wearing masks, that is a way of source control to prevent them from transmitting it to others.
So while, coronavirus cases are spiking in Georgia and further south, New York is really enjoying an incredible turnaround from being the epicenter of the virus here in this country to lower rates of infection, hospitalization, death rates plummeting as well. Not just New York, certainly the surrounding states are also proving that they have turned things around. What can the rest of the country learn from what New York did and what some of the other neighboring states have done, like New Jersey, to bring these numbers down?
So what I want to emphasize is that this took a really long time. Last week, we had one day where we had 0 deaths from COVID-19, but it took us 120 days to get there. And what it took was everyone wearing masks. It took good hand washing, and it took physical distancing, and it took us to the point where all non-essential workers had to stay home. So it really requires a significant collective response. And I think what we've seen in the states that have been very successful is a collective response and not an individual response. And so I was hoping from the very beginning that the states in the South and West would learn from the experience that we had here in New York City. It's not too late. And so I really hope that the governors of those states look at us and learn some really hard messages.
So I guess one question that I have, Doctor, is given the success of late that New York has had in other states in the surrounding area, is there a possibility that we could see a spike here? And I only ask that because with so many other states seeing spikes, and this country being one where people move generally freely between the states, even though there is a lockdown in place for people coming from Florida and some other states here in New York State, I wonder if we could see infections rising here. I do believe that the mayor of New York City said that they had started to see a very, very small uptick in infections, specifically amongst young people in New York City. So is there a danger here for us again in the state? I guess my question is the rest of the country immune to this, having gone through it in previous months, or are we still at risk?
No, I think we are still very much at risk, right? The virus knows no state boundaries. Well, that's one thing. And we have people, especially over the summer, traveling, visiting families, going on vacation. And I think there is a natural tendency for people to become more relaxed when they see the numbers are getting better, especially our young people who are out socializing, and we're seeing that uptick, especially among that patient population. And so, here in New York City, we still are on a pause, right? We're not doing indoor dining, which we know it increases the risk of transmission. And so I think we are learning from other states, from the South and West, what we saw with reopening in other states. And so I'm hoping that we are, going to still, follow the preventive measures that we need to follow in order to keep our numbers down.
Dr. Uché Blackstock, thank you so much. Always a pleasure talking to you.
Thank you for having me.